Here is what to expect during your PET-CT stress test. When preparing for your scan, it is necessary to not drink any caffeinated products such as caffeinated or decaffeinated coffee, tea, chocolate, and soda. It is permitted to have a light snack at least 4 hours before your exam. Once it is 4 hours before your exam, please refrain from any food or drinks besides water. If you have had any caffeinated products, please let the Carient staff know, as it may skew your test results or you will need to reschedule. Also, it is important to wear comfortable, loose-fitting clothing for your exam. Please avoid wearing any metal such as zippers, buckles, and jewelry. You will have to remove any of these items if you arrive with them on. We would like to remind patients that our PET-CT myocardial perfusion imaging scan is a safe and effective form of diagnostic imaging, and the radiopharmaceutical we use is not a dye or contrast. The minimal radiation you receive allows for a shorter exam time, and it is safe to be around others when you are finished. The total exam time is less than an MRI scan. When you arrive, the nuclear medicine technologist will confirm your identity with our records, ask questions regarding caffeine or food intake, and explain each step of the exam. It is important to mention if you have any complications resting your arms straight back behind your head, or if you are claustrophobic. One of the best ways to minimize anxiety and claustrophobia around the PET-CT scan is to use over-the-counter Benadryl by mouth 4 hours prior to the procedure. Using over-the-counter Benadryl allows you to avoid the usage of stronger benzodiazepine medications. Please ask your cardiologist about the use and appropriate dosage of Benadryl prior to your exam. As with any medication, it is important to understand that you must not operate a motor vehicle or heavy machinery for at least 24 hours afterward. If you are unable to take Benadryl and experience claustrophobia or anxiety, the Carient staff is prepared with materials and techniques to reduce the anxiety. If one arm is able to rest behind you for the 30-minute scan, we will place an IV in that arm. After your IV is placed, you'll be taken to the camera room for imaging. We will have you remove belongings from your pockets to prevent them from falling or making you uncomfortable. During your scan, you'll lay down flat on your back with a leg and head cushion. Your arms will be rested on the cushion behind your head. If one of your arms is unable to stay behind your head for the exam, we will be able to provide an armrest beside you. Electrodes and an ongoing EKG will be placed on your chest for the total exam time. Also, a blood pressure cuff will be placed on either arm. Once fully prepared, we will move you into the camera for a pre-scan and your resting CT. This will take about 2 minutes in the center of the scanner. The camera will then move further back, where we will connect you to the radio tracer infusion system for your first infusion. Your infusion is water-based with no side effects, only for imaging. We will take 10-minute rest images and then move forward to the stress phase. A medication will be administered which may cause patients to feel as if they are exercising. You may feel chest pain, nausea, dizziness, headache, or shortness of breath. It is completely normal to feel all, some, or none for 2 minutes. If it is too overwhelming during the 2 minutes, please alert the technician, who will be in a separate control room. The technologist will be able to hear and talk to you using a speaker and microphone. If the medication feels too overwhelming, we have another medication that counteracts any of those feelings. You'll then be administered another imaging infusion for your stress images. We'll take 10-minute pictures and perform your stress CT. Lastly, you'll be moved out of the camera and disconnected from the exam equipment. You'll be asked how you felt during the stress portion of the exam, and this concludes your PET-CT stress exam.